Once again, we welcome you to Moving Forward with Young Voices. Happy to welcome Layal Bou Harfouch back to the program. You've been on the show before, but for those who are meeting you for the very first time, take a moment here. Tell us a little bit about yourself.
Okay, yeah, great. So my name's Layal. I'm a drug policy analyst at Reason Foundation. So at Reason, I work on a lot of interdisciplinary harm reduction work. So that crosses over with criminal justice and drug policy, talking about different issues and how we can reduce harm at large.
You know, I'm looking at an article of yours from the Washington Examiner. The title is "Killing Cartel Kingpins Such as El Mencho Won't End the Drug Crisis, but Here's What Can." And, you know, I know the headlines are always moving fast and things are, you know, on the radar and then off the radar. I had almost forgotten about all the drama that took place earlier this year when El Mencho was killed, and there was, you know, quite a bit of violence taking place throughout Mexico. Talk to me about how has the Trump administration portrayed the removal of El Mencho as a cartel leader? Are they pretty much taking a victory lap on that one still?
Yeah, I mean, I think at this point it's pretty clear that they chase a lot of headlines and not a lot of actual outcomes, and that's exactly what they did with this. I mean, you know, taking out the head honcho of El Mencho, you know, El Mencho, it's not going to do anything for the cartel besides just reshape them, make them stronger, and you know, have them kind of, you know, like almost strategize on how to avoid this next time, you know? So.
And this is not something that's just happened for the first time. I know you reference when El Chapo was arrested. The Sinaloa cartel didn't fall apart like a soup sandwich. Instead, like you mentioned, they reorganized. So while on the one hand, it's got to be satisfying to see, you know, kingpins like this taken down in one form or another. In the long run, really, what does it do, though, in terms of addressing the drug crisis?
Yeah, I mean, you know, if we look historically at these events, it's more so about arrests and headlines than actually addressing the crisis at hand. And, you know, when you take out a cartel leader, you're just reshaping their whole infrastructure. That's all you're doing. And so, you know, it all depends on how we're measuring success. If we're measuring success by arrests and headlines, then we're doing absolutely fantastic. But if we're measuring success by actual lives saved and, you know, just yeah, we're not doing much in that realm. So I guess it depends on your lens. And with, you know, with this administration in particular, they take their lens and run with it. And they're like, yeah, this is a win, but it's hardly a win.
I think this is kind of true in general, though, you know, and speaking in very broad sense, politically, it seems like, well, our intentions are good. And here's something that seems to show that our intentions are good. But when it comes to results, that's a totally different story. So let's talk a little bit about, first of all, there is a drug crisis, correct? We're not pretending like such a thing doesn't exist.
Yeah, of course. I mean, there's still 80,000 people dying every year, albeit this was a bit of a dip from the past couple of years when we were hanging at around 100,000. But a lot of the success of that decline has been attributed to harm reduction interventions and meeting people more on the ground and targeted where they are in their life, and, you know, invoking a lot of harm reduction work, which is like, you know, naloxone to reduce or to reverse overdose, syringe exchange programs to reduce different diseases from spreading. And so yeah, there was a dip, but now, I mean, you know, this administration is taking a completely different approach. And so we're expecting a bit of a rise in the coming years.
I don't want to go too far off into the weeds, figuratively speaking, but it seems like, if I remember correctly, consistently, when it comes to the percentage of the population that will abuse substances, whether it's cocaine, methamphetamine, you know, fentanyl, whatever, it seems that percentage remains remarkably consistent regardless of what laws are in place. Does that jive with your understanding as well?
Yeah. I mean, because we're, you know, our approach to policy isn't really keeping up with the science. We have a lot of really great evidence on a lot of these interventions and how they work to make our systems more efficient. We actually reduce death and disease, which is the outcome we should be looking for, right? But there's always going to be this lag when it comes to policy because we rely on DC to make decisions for us when there's all this great work happening on the ground, and so there's almost this tension of like this drag. Okay, maybe in 10 years they'll catch up to what everyone's doing on the ground.
So, Layal, tell me about this. What are some of the things that do work? Because obviously, DC kind of has that one-size-fits-all approach, but there are other nations out there. There are other societies that have been fighting this battle as well. Can we look to other places for some ideas of what actually works in terms of helping to stem the drug crisis?
Yeah, I mean, there's so many great examples across the world, and it all stems down to kind of a few really great kind of interventions. So there's overdose prevention centers. We have one in New York, but it hasn't proliferated the same way here because we have what's called the crack house statute that prevents these sites from opening up. And basically, what they are is that they're a place where people go and use pre-obtained drugs in front of medical supervision. So if they do have a overdose event that someone has to attend to, they're immediately attended to. And then they have social services in the same area. So it's basically like a one-stop shop. They go there and they get all the resources they need, and it's all contained in one space. And it's an incredible tool. But unfortunately, we aren't able to kind of expand that in the same way given the federal barriers that are put up. There's also syringe exchange to reduce death and disease in that sense, where people get clean needles to inject instead of sharing and spreading HIV and hepatitis B, and then naloxone too to reverse overdoses. I mean, we have so many things that can actually be practical, meet people where they are, and also, work within the realities here. We can't make policy based off how we wish people behave. We have to make it in our reality and what we're working with here.
Well, and one of the things that really hits me is, I'll speak primarily addressing the federal approach, seems to be, well, the tougher we are on cracking down and making examples of people, and, even the tiniest little, they're found with the tiniest amount of drugs, we throw the book at them and punish them harshly and remove other people's, freedoms who aren't even doing drugs, just to be sure that nobody has the opportunity to do something wrong. It seems that a lot of people pay the price for what a relatively small portion of the population is doing in terms of abusing substances. Does that make sense?
Yeah, I mean, 100%. Enforcement alone has not developed public safety in the way that they're claiming. Enforcement alone has actually made things worse. It's pushed more people towards the black market, and the black market the supply is completely contaminated with things like fentanyl and other synthetic opioids, and it increases overdose risk. And that's all that this approach does. And until they recognize that, I don't think that we'll see a lot of great advancement in the public policy realm around drugs.
No, I think most of us would agree that life is better at every level, and more productive when a person isn't addicted to or, trying to overcome, or perhaps susceptible to overdose or something like that. But and I'll play devil's advocate for a minute. If we do needle exchanges, isn't that sending the wrong message? Isn't that telling people, no, this is great? Is that really the message it's sending? It's a tension for me because people get caught up on this messaging aspect. And I think it's like, it's a completely wrong idea. I mean, our goal here is to reduce death and disease. And unfortunately, public policy, it's not on government to decide when you stop using drugs. That is ultimately up to the individual, and treatment doesn't work that way where you just say you need to stop and then people stop. And so working within that reality to keep people alive and keep people healthy is really important, because you never know what happens next year, and people deserve that chance to get better. Okay, so we've got about 30 seconds left here. For people wanting to get more information on this, are there some resources you could point them toward to become better informed?
Yeah. Oh man. Yeah. I mean, there's so many things out there. I write a lot about this stuff too, and so my author page on Reason.org, we write a lot about different harm reduction in different domains. So child welfare, prison populations, and drug use, and so lots of information there. And I link a lot of great resources in my work. So would definitely recommend going there.
Again, we are talking with Layal Bou Harfouch. Where can people find you on social media?
So on X, it is Layal Bou Harfouch, my whole name, but without the CH because it was too long.
Thank you so much.
Thank you.
Welcome back to Moving Forward with Young Voices. Hey, we're happy to welcome Tosin Akintola back to the program. Now, for those of you who are meeting him for the first time, let's take just a moment here, Tosin, and have you tell us just a little bit about your background, who you are, and what you do.
Yeah, thank you for having me once again, Brian. I'm a journalist based in DC. My writing has appeared in the American Spectator, Reason Magazine, Real Clear Politics, to name a few places. And I'm a graduate of the University of Maryland, Baltimore County.
Well, I'm looking at an article you've written about, I would call this transparency in how government operates, in particular Massachusetts lawmakers fighting to keep public records off limits. And set the stage for me. First of all, talk to me about the ballot question that has them fighting to keep those public records private or at least out of sight. And then let's talk about why they would want to do so.
Yeah, absolutely. So to set the stage, Massachusetts has had public record laws on the books since about 1851. Their current framework basically presumes that every record that has been made or received by a government employee or agency is public unless a specific exemption applies. And this is kind of where we get into the meat of both the ballot question and then some other larger public records questions as well. So Massachusetts law exempts the governor's office and the state legislature from the requirements of the public records law of the state. The ballot question that's on hand right now would, as of 2026, basically allow for government, for documents held by government agencies that are federal agencies under the governor's purview and within the state legislature as well too. So all of the different state lawmakers will then be under the same requirements as every other office within the state. There would still be exceptions for, documents held by legislatures that are related to policy positions or between constituents in the legislator's office. So you would have that sort of privacy baked into the question as well. But what it would really do is just expand Massachusetts law so that the governor's office and the state legislature are also covered under the public record laws.
And maybe we could point to some of the examples as to why it's important that there be transparency when it comes to public records. I mean, I know in your article you mentioned the California hospice fraud scandal, which, as I understand, the arrests I think it may have just been within the last week or so, began to take place, and we're talking, millions, if not billions of dollars in fraud. What are some of the reasons why we need to be able to see what's going on? In other words, in what ways does secrecy not serve the public's interest?
Yeah, absolutely. Well, the irony is, I think it's right there staring us in the face, right? Public record laws are designed to ensure accountability and transparency in government institutions. Massachusetts carves out the very institutions that are most responsible for making democratic decisions. So when you have the state legislature and the governor's office exempt from your public record laws, it allows them to basically skirt the privacy, or excuse me, the accountability process for citizens and for residents of Massachusetts. The law covers a number of documents, so papers, photographs, tapes, financial statements, etc. And so some of these different data points and items could be useful for investigators, for journalists, for just your everyday citizen that kind of wants to keep track of how their taxpayer dollars are being spent and what's going on, whether it be within law enforcement or, as I've mentioned, within a specific federal agency or within a lawmaker's office. I think we all, as residents, if you're a resident of Massachusetts, but as residents of our different states, we all have the right to hold our public officials to account. We are the ones that elect them there after all. And again, taxpayer dollars are being spent by these institutions. I think taxpayers have the right to hold them to account as well.
Tell me a little bit about the exemptions that are in place in Massachusetts that, and let's, for that matter, why are there some times where maybe public officials should say, you know what, in this case, we need to exercise discretion and not release these public records? What do those exemptions look like?
Yeah, of course. So privacy exemptions, you think of things like HIPAA laws and different things like that, where, personal information or intimate details is kind of what the law calls it. So intimate details of a highly personal nature, anything touching on those like medical information, personnel files, if you're someone who works within a bureaucrat who works within the legislature or within the governor's office. There are also investigative exemptions for law enforcement that let them withhold records if it could, prejudice an ongoing investigation and, things to do with like confidential investigative techniques that they use. There's also a security exemption that would cover like blueprints, sort of like cybersecurity things, anything basically that could be what on the national level would be sort of national security. And so at the state level, sort of like state level security that could hinder emergency preparedness or any security plans that the state might have within what the law calls their reasonable judgment. And this is kind of where it leads it to a subjective nature, highly subjective nature, I would say. Within that reasonable judgment, of course, the government is allowed to basically exempt any document or any sort of records that they choose within those different exemptions. There are a number of them in Massachusetts. It's one of the few states, it's one of many states that has sort of a number of exemptions. Even the states with really good public record laws, like Florida, have thousands of exemptions, although those are more narrowly tailored. And so exemptions are a great way for governments to kind of skirt public record laws and still be able to hide some of the things that public record laws are usually designed to ferret out.
Tosin, I'm curious, are there other ways that that state officials might also frustrate people who are inquiring about their dealings, beyond just the exemptions? For instance, do they charge them? Well, it's going to take time and it's going to, take, personnel to do this. So yes, for a cost of at this much per page, we can get you the information you're looking for. Do you encounter that kind of stuff?
No, you absolutely do. The process is sort of made to be burdensome for the requester, especially in the case of Massachusetts, right? So they're public, but accessing them isn't simple for the person going through the process. You have to identify the right agency. You have to then submit the actual request, make sure that it's, worded and formatted properly. The wait time could be anywhere from 10 days to a month, depending on the agency and how many times they kind of stonewall you. And then there's the fee structure, right? It could be, you have to pay X many dollars per page or per hour that we have to, use to fulfill your request. That can add up if you're, just the average citizen or a single individual trying to access this material. If you're not backed by some sort of media enterprise or by, if you're a lawyer or a member of the court, you have the resources sort of to pursue that. If you're an average citizen, you likely don't have the time or the resources to go through complex requests that might need several steps. If you go through all of those, you check all the different boxes, you can still be denied based on one of the exemptions that I said, and then you have to go through an appeals process, right? But that, in Massachusetts runs through a state agency that basically is reporting back to the people that you're asking the request of in that case. And so it's a little bit of a catch-22 where ultimately, if your case doesn't go before a court and the court doesn't rule in your favor, and then the attorney general doesn't enforce the court ruling, you're not going to get those records, right? And so in Massachusetts, primarily, journalists and others have found that, even when you go through the exemption process and you check all those boxes, the state still finds a way to hinder you getting that access to those records because at the end of the day, they're really just trying to prevent you from actually getting those records. It's really not about fulfilling all due diligence and being, going through the request in good faith.
We've got just about a minute left, but I have to say, I know that, there are people out there who kind of find purpose in being a problem for people in elected position and, who would do what they could to hinder, their elected officials. Is there a way to strike a balance between the need to be transparent in how, public records are kept versus let's not feed the trolls, so to speak? Yeah,
absolutely. And as I mentioned, Florida is one of those states that has, unique and sort of tailored exemptions. So they are narrowly construed so that, if the exemption has to fit that exact narrow criteria or it doesn't pass, right? And so that is a much better way of doing it, where you can still have exemptions for, as I mentioned, personal details, communications between a constituent and their legislator. Those will all be protected, even under the ballot question that is being sponsored in Massachusetts, or that is being offered, in Massachusetts. But when you have these overly broad exemptions, it makes it so that, things get lost within these larger exemptions. And sorry, I apologize for running long.
Tosin Akintola, thank you so much for joining us today on Moving Forward with Young Voices.
Thank you for having me, Brian.
And we are back on Moving Forward with Young Voices. Happy to welcome Christopher Gardner back to the program. Christopher, we've had you on here before, but I want to, of course, give you a chance to introduce yourself to those who may be meeting you for the first time. Please take a moment. Tell us about yourself.
Yeah, of course. First of all, Brian, thanks so much for having me on. It's always good to be back. So for those that don't know me, my name is Christopher. I'm a tech policy researcher based in Washington, D.C. And as a Young Voices contributor, I primarily focus on issues of AI policy, antitrust, and free speech online.
Well, let's talk about free speech. And actually, I'm looking at an article you've written about Section 702 of the Foreign Intelligence Surveillance Act. And I'll admit, I've let this one slip off my radar screen. So for people like me who maybe need a little refresher on FISA and Section 702, let's talk a little bit about what that section entails, and then let's talk about how it applies to free speech, which presumably we're all about here in America.
Yeah. So Section 702 of FISA, so the Foreign Intelligence Surveillance Act, is a provision of FISA that allows for the warrantless surveillance of foreign nationals. And so there's a few different programs that we know about through which this is carried out. One is called PRISM. And so that is, and both of these I think were brought out in 2013 with Snowden and his whistleblowing. And so PRISM is essentially major tech companies are required to hand over certain information to government agencies in the NSA. The other side of that is that that we know of, the NSA taps directly into the upstream, so the very backbone of the internet infrastructure to collect communications abroad. And so that broadly results in a large database of communications between foreign nationals, but then also it can incidentally catch up the communications of American citizens. And so this is kind of one of the core issues with revision is not only is there concerns about the free speech, so there's a lot of empirical literature that demonstrates that the surveillance and mass surveillance has direct correlations with an increased concern over behavioral conformity. People are less willing to speak out in hostile environments and express themselves online. And then also there's the fact that you are conducting kind of a backdoor surveillance of American citizens, and there's a lot of potential for abuse. That's kind of the core of Section 702 and the two core concerns that I'm trying to hit on here.
So I've got to first ask, why is it that something like this, which as you describe it, I feel some gravity, like, whoa, this is really important stuff. But it seems like a lot of this flies under the radar of many Americans. What are we missing, or what are we not paying attention to? And for that matter, why should we be paying closer attention?
Well, a lot of it comes from the fact that, so this was passed kind of in the aftermath of 9/11. And so it was a part of this big push to make sure that, these terror attacks never happen on American soil again. And so it's come up for reauthorization several times. And over time, there's become increasing revelations of abuse. So, for example, in 2023, it came out that the FBI had queried U.S. personal identifiers for a U.S. senator, a state judge, George Floyd protesters, and also January 6 protesters. And so largely it flies under the radar because there's a lot of rhetoric surrounding the fact that this is important for the protection of American citizens. And then, this is a little older kind of argument, but there's always the, if you have nothing to hide, you have nothing to fear. But the reality is that, and so it's coming up for reauthorization on April 20th. So I think just about a couple weeks away. And the reality is this really serves to undermine America's position abroad when we push free speech, and then also at home it undermines our right as American citizens to due process. And so it's really important that we need to put in more protections. And as this comes up for reauthorization, there needs to be serious reform before Congress allows it through.
So does Section 702, does it come up yearly for renewal, or I'm just curious, has there ever been a doubt that they're not going to renew it?
So in 2024, this was a major concern, and kind of the primary reason that people weren't considering as to whether or not to, or weren't considering reauthorizing it, was because of these revelations that came to light about the Biden administration's use of this massive database that collects American citizens to look for foreign communications with a U.S. senator. And so that really serves as a violation of, I mean, what I would consider to be the separation of powers. Like, in what world is it right for an executive branch or executive agency to go after sitting American legislators? And it's very concerning. And then turning back to the issue abroad, it's been a core part of what has made America great. And a core part of our founding is the fact that we embrace freedom of speech and we push freedom of speech. And, it really points out to that hypocrisy is to how can we push freedom of speech abroad if we have these mass surveillance programs in the US? And it goes so far as to surveil elected officials is really concerning. And I think it undermines our position and our principles around the world.
Christopher, this is a very subjective question, but I have to ask, do you see a growing inclination on the part of the current administration to, I won't say censor, but at least to influence and in some cases restrict speech? For instance, criticism of Israel seems like that if you do that, you might be painting a target on yourself.
Right. Well, I think it's interesting because it depends on who you talk to. Some people would, so first of all, let me make this clear. Anytime you delegate power to the executive agency, particularly without really strong checks in place, I think that power is going to get abused. And so in the case of FISA, that was put in place for counterterrorism, but now it's being used for counter narcotics, counter foreign intelligence. These are all like the scope creep is a constant concern. Now, under the Trump administration, you're seeing a lot of very high-profile cases, particularly in the example of the FCC. So Commissioner Brendan Carr has a pretty strong and bad reputation with trying to meddle in affairs of particular major mergers. So the Paramount Skydance merger was kind of a prime example. And then, of course, there was the Jimmy Kimmel incident where, we're going to do this the easy way or the hard way. So it comes down to, I think that we're seeing a lot of these impacts and decisions to affect free speech. And it's happening now more out in the public, more brazenly than it has in the past. So, for example, during COVID, there was, Biden's the Twitter files. So Biden kind of jawboning Twitter, now X, to try and take down claims that ultimately turned out to be true. And so it's just a part of a broader concern where we're seeing a trend that elected officials are more willing to use their power to silence disfavored views.
Okay, we've got about a minute or so left. Again, let's touch on freedom.gov. What is the purpose of this this website, and good or bad? What's your call?
So I think it's a great project. It's very needed because around the world, including in liberal democracies such as Australia, the EU, and the UK, you're seeing a broader movement towards speech restriction. So in Australia, there's U16 social media ban. In the UK, there's the Online Safety Act, which has resulted in several high-profile arrests. And the EU, there's the Digital Services Act. Now, I think freedom.gov was developed in order to help people bypass those content restrictions and retain their anonymity online. And these are both very important for free speech, very important in the political discourse. People need to be able to express themselves and their views without being concerned. Now, the ultimate question is, why would people use freedom.gov if we have something like Section 702 on the books, which then says, everything that you use this for is going to be tracked by the American government? I think it's a core hypocrisy. It's a core concern, and it's a bit of a paradox. So
no, that's a great summary there. Again, we're talking with Christopher Gardner. He is a Young Voices contributor. Christopher, where can people find you and connect with you on social media?
Yeah, you can find me on LinkedIn at Christopher Gardner and on X at C_Gard 88910. So thank you so much. I really appreciate the opportunity to be on here. And Brian, great to see you again.
And we are back. This is our fourth and final segment today on Moving Forward with Young Voices. Happy to welcome Iulia Lupse back to the program. Good to see you once again. For those who are meeting you for the first time, could you take a moment, tell us a little bit about yourself?
Yeah, thank you so much for having me. And I'm a freelance journalist and a Young Voices contributor, focusing heavily on tech and innovation issues at the moment, as well as the founder of INA Communication Solutions, which is a ghostwriting and communication services company.
Well, I'm looking at an article that you've written for freethepeople.org, why we should let AI compete in mental health care. And I got to be honest, I never really thought I would see the day when AI and mental health care would be mentioned in the same context. But I've actually seen a number of people express concerns just in recent weeks about how AI kind of becomes a mentor or a counselor to people. And sometimes it was in good ways. Sometimes people said it was not such a good thing. Talk to me a little bit about in what role are we seeing AI assist with mental health care, and then let's talk about states and what they're trying to do to regulate that.
Yeah, so essentially, I started writing this piece based on my own experience with therapy. So I've tried traditional talk therapy, which was very expensive, time consuming, felt like I was talking around in circles, and it's hard to find like a good therapist. At the same time, I had just left my corporate job, so I didn't have insurance, which added another layer. Then I did an EMDR, which kind of helped. But for smaller day-to-day issues, and especially when you don't have insurance or you can't get to a clinic, I've played around with AI tools, which I found surprisingly helpful for things like organizing thoughts and calming things down. And that's kind of where my question came from. If something like that can help even a little, why are we so quick to shut it down? I mean, America's mental health system is in crisis. Over 122 million people live in mental health deserts, which means that the nearest clinic is more than 30 miles away. Millions are uninsured, and wait lists already stretched for months in some places. And this is happening while the federal workforce projections estimate a shortfall of nearly 88,000 mental health care counselors within the next decade. So at exactly the same moment when AI tools are emerging, that could fill those gaps, several states are pushing to regulate or effectively ban them. And my argument is essentially that we can have guardrails without barricades. We should let these new tools compete, test, and improve under supervision, not shut them down. And we've already seen early clinical trials showing meaningful symptom improvement with AI-supported tools. For example, a 2025 randomized controlled trial of a generative AI chatbot found significant reductions in depressive symptoms and anxiety. So yeah, there's definitely benefits to it. Obviously, children, that's a different story altogether, but I say let adults be adults.
What are some of the dangers that prompt this? I'm going to call it overreaction, but that need for absolute safety that some of these states are trying to exert here. Well, let's build a barricade. What have they seen or what have they heard that makes them think that we have to preemptively, stop this from becoming a thing?
Yeah, so there are real dangers, and I don't dismiss those cases. For example, there's been instances where teenagers use AI chatbots in ways that were clearly harmful, including situations involving suicidal ideation. There was a case related to a 16-year-old who tragically took his life, and then his parents later found that a chatbot he was talking to offered to write their son a suicide note, and that's absolutely devastating. But like I said, I want to be clear. My argument is about adults. Risk alone shouldn't be a policy framework. I mean, if we applied that standard consistently, telehealth would have never been approved, and neither would most of modern medicine, which progressed through trials, failures, iterations, and evidence. And that's why I think it's a little bit concerning that all these states are pushing forward with regulations before actually letting the tool letting us see where the tool can take us.
And I don't portray myself as any kind of an expert on AI, but I've used enough of different AI programs to recognize they're not all the same. Some of them are very agreeable, almost to the point of fault, where they're like yes men, for lack of a better word, and there are others that are more honest. Does any of the proposed legislation take into account the different approaches that some of these AI systems use?
So from what I saw, it really depends. It's kind of all over the place. So last year alone, state lawmakers introduced more than 1,000 measures related to AI, and a growing share of those were focused specifically on healthcare and chatbot interactions. For example, Illinois passed a law that allows AI in mental health settings only for administrative support, so like scheduling, billing, that kind of thing. But it bars it from what the law calls therapeutic communication. And that definition is broad enough to include offering emotional support, providing behavioral feedback, and things of that nature. An AI tool can't walk someone through a standard CBT worksheet or a supervised journaling exercise without triggering licensed clinical oversight requirements. California, too, going in the same direction, requiring repeated disclosure, strict prohibitions on anything that implies professional status, and proposals. And also it has proposals that would tie chatbot operators to license responsibility. And I get that the intent is consumer protection, but the practical effect is to make small scale testing legally risky before there's any evidence of harm. And on the other hand, there's Utah, which has offered a different approach. And I think that this is an approach that could better address the issue. Instead of preemptively banning entire categories of interactions with these chatbots, Utah basically allows companies to test the tools under monitored conditions while regulators collect real-time data on what's actually happening. So it assumes two things: that risk exists and that evidence matters. So you supervise the experiment rather than prohibit it. And that's how you build a real evidence base. So if problems come up, you have the data to address them proportionately. And if the tool is working, then you can scale that responsibly.
Just out of curiosity, what is the response of counselors and therapists human counselors and therapists within the mental health system? Are they facing the prospect of, hey, I'm going to lose my job to AI?
Yeah, so I think there's definitely, I mean, in many industries, I think that question looms over a lot of people. But I'd say that, the skills that therapists have are irreplaceable, and I mean that genuinely. But what I'd also say is that the current system is so understaffed and so expensive that the therapists are already being asked to carry a load that they might not be able to. So if AI tools can handle some of the lower acuity volume, structured journaling, CBT exercises, I don't see that as competition for therapists. That's freeing therapists up to do the work that only they can do. So the scarcity problem in mental health care doesn't get solved by protecting existing providers from any new tool. It really gets solved by expanding the overall capacity of the whole system.
I like your approach here, and I like it because you're talking about let's not wait until we have the perfect system of AI and nothing could ever possibly go wrong. It acknowledges that it may not be perfect yet, but let's not lock it down so that we can't improve on it, which to me makes a lot of sense. Are there states that are open to this at this point?
So I'm only mostly seeing Utah that's trying it. I know a bunch of red states are playing around with it, but right now it's still, I think regulator or lawmakers are trying to figure out what to do, and they're just, I think, jumping to conclusions a little bit too soon.
Okay, well, again, speaking as a noob to AI, there's a lot that I don't know about it. And so there's a little bit of mystery, and that can be a little bit scary in and of itself. But it sounds like what you're calling for is, well, if we're going to improve it, let's do it out in the open and see what happens.
Yeah, good guardrails, but also transparency, and let technology try to save or help us solve our problems.
Okay, well, this is just another aspect of AI now that I'm going to be keeping an eye on, because I didn't realize, the inroads that it had made so far. Again, we're talking with Iulia Lupse. She is a Young Voices contributor. Where can people find you on social media?
Yeah, so I'm on X at IuliaL27, and you can find me on Substack at Unfiltered with Iulia.
Very good. Great to visit with you once again. Looking forward to our next conversation.
Thank you so much.